Let us look at the immune aspects of the COVID-19 vaccines. We know that about 7 vaccines have been approved for COVID-19 and 4 have been abandoned so far. So important take-home message is that not all vaccines that were developed were approved. Some had to be abandoned. This is a table of some of the characteristics of the vaccines that have been authorized or approved. And you can see the efficacy that is given in one of the columns of these different vaccines. So the studies have shown that most or all these vaccines are quite efficacious, and we will go into more detail about these values as in the next few slides. It's important to know that there are a number of variants, SARS-CoV-2 variants that have developed. We have the UK variant, the South African, the Brazilian, and the Indian variant. The name refers to where the variant was first identified, and I put the numbers in the slide. In this short clip, I will talk about infection, disease, and transmission, and then talk about the efficacy and effectiveness of the vaccines. So when a person gets infected with the SARS-CoV-2 infection virus, some of them develop mild disease, some are asymptomatic, and a few, or certain percentage, develop severe disease with death, ITU care, hospitalization. And this is what we want to decrease with vaccination. We want to change it from a severe disease to no disease, or the person developing mild disease. So a person can be infected and then can develop disease. Those who have the disease and those who have infected can transmit the virus. And the importance of vaccination is to reduce disease, but also try and reduce infection. Efficacy refers to the findings of a clinical trial, but we are interested in effectiveness, the real world, what happens in the real world, because a clinical trial is a control setting, and we would want to know the data as it occurs in the real world when it's rolled out, the vaccines. Now we know the vaccines are efficacious. These were the studies that have been published in big important journals, the Pfizer vaccine, the Moderna vaccine, and the AstraZeneca Oxford vaccine. All were beneficial and efficacious. The next study showed that interval of 12 weeks produced a better immune response than if the interval was shorter for the AstraZeneca vaccine. This was the study showing the efficacy of the J&J vaccine, the Johnson vaccine. So we know these vaccines are efficacious. The UK government, and the efficacy is shown in this slide again, in the penultimate column. The UK government took these findings and rolled out vaccination from December. 9 groups were identified initially, and that all those 9 groups have been vaccinated so far. So the question that arises is, are these vaccines effective? And this slide clearly shows that the number of cases of SARS-CoV-2 infection were rising, and with vaccination, there was a turn in the curve, and the number of cases reduced, number of deaths, number of hospitalizations have reduced if social distancing and vaccination goes hand in hand in the population. This was a study from Israel, and again, you can see those that did not receive the vaccine is shown in red, and those that received the vaccine is shown in blue, and there is a big difference between those who received the vaccine with regards to reduced death, hospitalization, and ITU care. So what is the summary of this? The US, UK, and Israel have produced studies which show that the vaccines are highly effective against symptomatic and asymptomatic COVID-19. the Pfizer vaccine was 89% effective. This is real world data. And there was a 60% lower hospitalization with the Pfizer vaccine. In England, healthcare workers, adults greater than 80 with comorbidities, again had a reduction in infections reduction of COVID-19 of about 86%. Israel, where 2 Pfizer vaccines were given to a big group of the population, again had an effectiveness of about 90 to 94%. And there was a 4-fold reduction in the viral load in people who received the vaccine. So these are effective vaccines. That's important to remember when we are rolling it out to the wider population. What about the viral variants? This figure shows a reduction in neutralization, that is lab tests done using the serum of people who have recovered from COVID-19 or those who have received the vaccination. There was a reduction in neutralization when the South African variant was considered. That was in bar 4. There was a significant reduction. Similarly, with the Moderna vaccine, there was a reduction in neutralization. However, the important aspect is, because these vaccines are so good, the level of neutralizing antibodies was so high that even with the reduction, still they were effective in reducing severe disease, mortality, and that's deaths, hospital care, or ITU care. And that's an important thing to remember, that if you give a good vaccine, that there is some headroom that could be present before the vaccine does not have a sufficient effect. When it comes to the Oxford vaccine, this is a real-world study. They assessed the Oxford vaccine against the UK variant, and they found it to be effective. However, in the small study that was done in South Africa, the Oxford vaccine was not effective against preventing mild or moderate COVID-19 in a South African setting, and that was the South African variant. However, it still was able to prevent severe disease. So in summary, you find that the immunogenicity is reduced or reduced neutralization with some of the variants. The most reduction, the highest reduction is with the South African variant and the Brazilian variant, while the UK variant is not neutralized to, the neutralization doesn't reduce to a great extent. We must remember that at the present moment, we don't have a biological correlate of protection, and thus we cannot measure a certain antibody level or T cell level and say, okay, you're protected from getting the infection in the future. We must remember that the neutralizing antibody levels produced by the vaccines were even higher than those seen in patients who had COVID-19 and recovered. So in summary, the effectiveness of the UK of the vaccines in the UK and Israel as against the UK variant is quite high. However, there is a drop-off when it comes to the South African variant, as also seen in the J&J vaccine. So in summary, I've told you what infection was, what disease is, and about transmission. Those who are infected, those who have disease can transmit the virus. What we want to do with vaccination is to reduce the disease severity as a first step, and then move on to also reduce infection and transmission. So disease severity is reduced to a great extent with the present vaccine. Infection is reduced to a lesser extent. I've spoken to you about efficacy in a clinical trial setting, and the vaccines are very efficacious. I've told you about the effectiveness and the studies that have come from the UK, Israel, and from other countries such as the US. And I've spoken to you about COVID-19 vaccines and the SARS-CoV-2 variants, and the variant that we should keep an eye on is the South African variant, as there is a reduction in neutralization, but because the vaccines are still very good, the reduction in neutralization is still able to prevent severe disease and hospitalization. Thank you.